Hi everyone. Today we are going to be presenting sleep problems in pregnancy. My name is Jade McBroom and this is my partner Helen Clark and we'll be presenting this today. So just starting out with a description of typical symptoms or things you may experience but are completely benign, which means that they're not necessarily pointing to a serious problem. So in the first trimester, pregnant women may experience frequent waking due to an increased need to go to the bathroom, disruptions during your sleep because of physical and emotional stress related to pregnancy, and increased daytime sleepiness. During the second trimester, sleep is improved because of the baby's position, but there still may be poor sleep with a growing baby and emotional stress. During the third trimester, there is a lot of discomfort because of the growing belly. Women may experience heartburn, leg cramps, and sinus congestion, and there is frequent nighttime urination. So, describing how many women actually experience sleep problems. So, 78% of women reported more disturbed sleep during pregnancy than other times in a study by the National Sleep Foundation. 15% developed restless leg syndrome during the third trimester. 51% reported at least one weekday nap, and 60% reported at least one weekend nap. So, what's kind of contributing to these problems during sleep problems during pregnancy? Well, first, it's the changing hormone levels. With the rising progesterone in the first trimester, this may explain excessive daytime sleepiness. Also, the hormones may have an inhibitory effect on muscles, which results in snoring. There's an increased risk of developing sleep apnea in heavier women and nighttime trips to the bathroom. Another part that kind of contributes to these sleep problems includes insomnia related to emotions and anxiety about the labor and delivery process, balancing motherhood and work, changing relationship with the partner, especially within new parents, and first-time mothers are especially at risk for insomnia related to emotions and anxiety.
So, fortunately, sleep problems are not really often a sign of more serious conditions, but we would advise our patients that if they have persistent fatigue that doesn't necessarily improve, if they get a better night's sleep, or if they're just feeling tired all the time, regardless of their quality of sleep, that may be an indication of anemia, which could cause complications for them and their fetus. So we would definitely advise them on signs about, what's a normal level of fatigue due to sleep problems and what could be indicative of a larger problem with anemia. And then we'd also talk to them about sleep apnea, which is pauses in breathing during the night. So if they're noticing that or if their partner's noticing that, we definitely want them to be evaluated further because sleep apnea can reduce the oxygenation that their fetus is getting, which can cause problems with development and can also lead to a higher incidence of preterm birth. So for prevention and treatment of sleep problems, we definitely highlight that heavier women are at a greater risk for developing sleep problems during pregnancy because heavier women are at a greater risk for sleep apnea. So if we're doing pre-conception counseling, we may advise them to achieve a healthier weight before they become pregnant. We'd also advise them, if they're already pregnant, to try and reduce daytime napping, reduce emotional stress as much as possible, and exercise. And these are all components of sleep hygiene. So sleep hygiene, stepwise, limiting naps to 30 minutes during the day, avoiding caffeine close to bedtime, at least 10 minutes of aerobic exercise every day, avoiding spicy foods before bed, getting sunlight during the day, and dimming indoor lights and screens at night, establishing a regular bedtime, establishing a relaxing bedtime routine, like taking a bath or reading a book, creating a relaxing atmosphere in the bedroom, and then only using the bedroom for sleep and sex. And there are pharmacological measures that are available to pregnant women. There aren't a lot of reproductive safety research on sedative hypnotic therapies like Ambien or Lunesta, but tricyclic antidepressants may resolve sleep problems and have not been associated with fetal development complications.